lot to discuss this morning, so stay tuned.
Good morning, Nigerians. TJ, I think we should just go ahead with what we have.
All right. This morning, we'll be reviewing a development with far-reaching humanitarian and security implications, and that is the recent cut in U.S. humanitarian funding and what it means for Nigeria's northeast, for a region still grappling with the aftermath of insurgency, displacement, food insecurity, and fragile recovery systems. This decision raises urgent questions about sustainability, donor dependence, and the future of critical aid interventions. For years, U.S. support has played a significant role in funding food assistance, healthcare delivery, shelter education in emergencies, and livelihood programs across Borno, Yobe, and Adamawa states.
With funding reductions now on the table, stakeholders are weighing the potential strain on state governments, humanitarian partners, and vulnerable communities already on the brink. Could this trigger deeper humanitarian gaps? Are local institutions prepared to absorb the shock? And what does this mean for long-term stabilization efforts in the region? And to help us understand these pressing concerns, we are joined this morning by Dr. Goje Mohammed, Executive Secretary of the Yobe State Emergency Management Agency, a frontline official coordinating agency response and resilience efforts in one of the most affected states in the Northeast. Dr. Mohammed, nice to have you here with us.
Thank you very much, and happy to be here with you.
Yeah, talking about the U.S. humanitarian funding cuts, to what extent would you say this has impacted on the humanitarian operations in Yobe and also in the Northeast generally?
Thank you once again for having me in this morning breakfast show. Before going into the impact of the funding cut, we need to reflect on what has been the effort in the past and what has been the support from the U.S. in the past. U.S. funding has been consistently one of the leading funding that has been supporting humanitarian needs and efforts in the Northeast, particularly in the Bay State, the Borno, Adamawa, and Yobe State over the years. And this funding supports through health, livelihood, food security, GBB protection, and other sectors. According to the United Nations OCHA financial tracking system of 2024, out of the $916 million that were earmarked and needed for response in 2024 to support 4.4 million people in need, $526 million has been realized. And out of these $526 million in 2024, the United States of America provided about $320-something million, amounting to over 57% of that support. And that money goes into saving lives in health, polio, HIV, disease outbreak investigation, food security, through United Nations organizations, WFP, UNHCR, UNICEF, other INGOs, and other local partners. And this, to say, is a very big effort, because when you save 57% of an amount that is needed to save 4.4 million lives coming from the United States of America, it means it's a big effort. But then coming to the impact, in early 2025, the executive stop-work order that was direct issued led to the stopping of halting of all activities of USAID globally, which Nigeria is part of it. But specifically in Northeast, it's not just about stopping USAID support. It's just a proportionate stopping of work that is impacting on lives of over 4.4 million people in need. And this is more than just a partial stop. But then beyond that, it has impacted different sectors, starting with the United Nations organization who are indirectly providing the support to the people in need, the manpower reduction, going into the details of the affected population. This affected population, we have out-of-school children, we have IDP population, we have pregnant and lactating mothers, we have HIV/AIDS victims, we have disease outbreak surveillance, investigation, gender-based violence, survivors for protection support. These are numbers that are linked to the executive stop-work order. But beyond that, how does this translate to the deeper impact at the community level? For every household that is being impacted by the stop-work order, there are dependents, there are numbers that rely on the channel of support that is coming from this response from the United States aids. And it's coming at a time when most of the plans, there's no specific exit plan that will give time for other partners to take over, for more resources to be mobilized, and also to strengthen the gap that has been created. So it has created a big impact. And worse is the 2026 model, where humanitarian partners should either pause, compete within limited resources, or they have to completely disappear. Because there's limited funding, and this funding comes with a lot of oversight and a lot of competition that it even goes beyond determining the need and the response that people, those organizations will do.
All right, Mr. Mohammed, I would like to come in here with this question, and that is, now that we have this humanitarian cuts, why does it seem that we heavily rely on foreign funding? What happened to our local response system in Nigeria? And now that we, the foreign funding has significantly shrunk, is there like a plan in place to, mitigate whatever funding that was coming that is no longer coming, to ensure that, your organization now and other communities that have been affected by insurgency and what have you, does not slip back into, what led them there in the first place?
Thank you very much. I will give you an example from Yobe down to the northeast and to the broader Nigeria at large. For instance, in Yobe State, when we received the news of executive stop-work order, His Excellency Governor Boyi directed that we immediately go on to a deep dive assessment to identify the gaps. And that's what we did as early as 2025 when we received the stop-work order. And the assessment brings about numbers that are scaring. But of course, the primary responsibility of government is to save lives. UN partners, USAID, and any other organization is just complementing what government can do. So the advantage we had was, today, if we have not lead from the front, if we don't know how to get these numbers, if we don't know how to take over our responsibility, these numbers will keep scaring, and we're going back to decades-long gaps that we have already closed. So locally, over the years, we're able to ensure that for any partner that comes to the state, the government should lead the process. For every partner that we plan, they should plan in line with the government priorities. But of course, they will implement based on their budget and on their funding. So after our assessment, we realized that in Yobe State alone, over 13,000 out-of-school children will be affected. Over 250,000 people in general will be affected in terms of IDPs, in terms of out-of-school, in terms of those that need gender-based violence protection, in terms of those that need health services, across all the sectors. So as government, what we did was to analyze and see where are the gaps. For health sector, we shared the data with the health relevant agencies, prioritize these gaps, look at available opportunities. There are other existing funding through the World Bank, through EU, through other funding sources, maximize those fundings and close the gaps. In terms of food security, we have, because of the stop work order, over 650 metric tons of food that is being distributed every month by WFP has been stopped. This is affecting 65,000 households every month. What did the government do? Okay, out of this 65,000 households, the government now directed that come up with a plan to sustain the response to some time. Because when people are in need and the basic means of their livelihood is being cut, there's likelihood that they will, the coping mechanism will be very difficult, and they will go back to negative coping mechanism, and consequences will lead to insecurity. Overall, in the Northeast, About 2,500 aid workers have been relieved. This is manpower, this is labor, these are people that are family dependents and other things. But in the model that we develop in the Yobe State, we make sure that the aid workers, especially those that are in nutrition, supporting malnourished children and other things, are being absorbed into the system. And this is the model that is working. And luckily, this also translates to what we advocate at the higher level, that when there are crises, when there is gap, when government is filling the gaps, there should be measures in place that will make it sustainable.
All right. I like those. What the last thing you said, that should be measured in place. Now let's take a critical look, because the figures you are giving are quite alarming, and the gap is quite huge. Taking into cognizance the fact that the Northeast is also a region that is highly challenged with the insecurity, so you have a lot of people that are displaced. And if we have these people that are displaced, which means they can't go to the farm, they can't do all those stuff. I remember that this present, the APC national chairman made a statement just before he left as minister. He was talking about the emergency fund, that he's advocating for the creation of an emergency fund. Now, with what has just happened with the U.S. cutting its funding of humanitarian activities, we don't know the next partner that will cut theirs also, which means we can't afford to depend on any donor nation. We must build our capacity to the point where if they come in, good. If they don't come in, it does not affect anything. The Yobe example and the Northeast example, you're thinking of pulling together a kind of a fund in collaboration with something like the Northeast Development Commission that is there. You're thinking of a fund so that we can sustain this humanitarian service, and we don't need to go back and say we have huge gap. So that going forward, whatever happens, whatever shaking happens, we can assure our people that, look, we are there for them.
What we did as government is to develop a humanitarian sustainability framework. Okay. And the humanitarian sustainability framework comes with 5 phases. The phase 1 is leadership and governance. Government must lead from the front. The phase 2 is coordinated exit strategy. Going into the future, for every partner that will come into our state, there should be an exit plan. And the exit plan should be minimum 12 to 18 months. If you're exiting your project, there should be a plan that will sustain that exit plan for 12 to 18 months. That is enough time for government to reprogram and include those gaps into the budget. The third phase is to build the resilience of our people. And that's what our government is doing. At the federal level, when you look at the market price of commodities, market price of commodities has come down. But at the local level, the money is not enough for people to afford even the cheapest the price of commodities. So what the government is doing now is to intensify and invest in agriculture, provide mechanized tools for farmers at a subsidized rate, so that when they want to go to the farm, there's the fear that at the end of the harvest, I cannot be able to recover my investment, will not be there, because government has provided a subsidized tool for farming. And the next, the fourth phase is to ensure that there's accountability and monitoring for the implementation. And at the end of the day, this framework will be institutionalized so that every partner that comes in will work along that path. But then coming back to the issue of funding, either from our regional commissions or the national government, part of the sustainability framework we develop is NEMA, NEDC, National Refugee Commission, and all the other partners from the federal and regional governments will be informed on the existing gaps, so that where the need is for food security, they have a budget line to support that gap, to fill in that gap. And where the need is in terms of livelihood, protection, and other things, they have relevant budget line to key into those gaps. But the most important is for us to realize that this is our primary responsibility, and we have taken that. Identify the gaps, we have done that. And take the bull by the one that to approach it, key in those gaps into our budget. When we are developing the 2026 budget, of course, we are hopeful that USAID funding will return, because globally, humanitarian and recovery takes a lot of time. the conflict in the base state, in northeastern states, will take lot of years before we fully recover. So stopping aid work at the time will invariably take us back to years we're not praying for that. So while we hope that aids will return, we are now working towards putting those gaps into our budget.
All right,
So the 2026 budget will reflect and improve on some of these gaps.
All right, we'll continue this conversation, but that will be right after this short break. Don't go anywhere. We'll start a conversation with Dr. Goje Mohammed, and we're discussing the implication of cutting U.S. funding cuts to the Northeast. Now, I'd like to understand, was there any accountability concerns raised by some of these donors that might have warranted, this decision to cut funding to the Northeast and, did they raise any accountability concerns? And what is your accountability structure like?
I think as government who leads from the front in terms of implementation, accountability to the affected population is very key. And as a humanitarian worker, these are some of the watchwords of every humanitarian agency that works in the field, and it's the responsibility of the implementing partners to be accountable to the funds that come from the donors. But of course, accountability issues are subjective, depending on what the donor wants, how it wants their money to be spent, and what are the priorities at hand. But by and large, it's more of an increasing demand globally. There are, even in Nigeria, the humanitarian need assessment that is being conducted every year. For instance, for 2026, we need $560 million to respond to 5.9 million people across the Northeast. But of course, in Nigeria now, there are other demands. When you go to the Northwest, when you go to the North Central, there are needs, humanitarian needs in those areas. So globally, there are needs everywhere for funding, and donors may shift priorities to other locations, geopolitical issues and other things. But by and large, for every UN partner that implements projects, whether in Nigeria or any other place, accountability to affected population is very key. And as government, we make sure that that is in line with the policy of government at the implementation level, and affected people are at the forefront.
Okay, now we're going into a circle where we're going to have some humanitarian crisis, because we're going to be entering the rainy season and all that. And you also have the security challenge, and you're going to have this probably flooding and all that compounding the crisis. And you don't have this major donor come upstream. Now, would you say that the prolonged presence of donor agencies have unintentionally slowed down our capacity? And could this be a blessing in disguise? That for once we're facing the stark reality, how do we solve our humanitarian crisis without the watches of a big donor?
I partly agree and partly disagree. I disagree because I wouldn't have been here without being part of the process to learn how to get this information, how to learn how to acquire this data, and how to lead from the front. It's because the donors are available, the government is there, and we're working hand in hand, and we're leading, and that's why now that they're exiting, we have some level of capacity to discuss, take the bull by the horn, and use our skills to fill the gaps. And partly agreed because over time, overdependence leads to being reluctant and waiting for resources elsewhere. But now that there is an exit and there is gap, as government, we have now realized that these responsibilities should, going into the future, be well guided. And that's why I keep emphasizing on the exit plan. Nowhere in this world that government alone can respond to the needs of the vulnerable, especially after a conflict. After conflict, it takes decades. No matter the resources injected by government, it takes time before you recover. And recovery is in phases. And as much as government wants to invest in the recovery process, partnership, both local and international, are key, because that's what drives the accountability, and that's what gives people the hope that that's what brings the resilience. for a common man in Machina that is being displaced, seeing resources coming from as far as Europe to support them, gives him that feeling that his predicament is being felt not only within his immediate community, but also elsewhere. And that also builds resilience over time. So partly is okay, and partly is the other way.
All right, I would like to understand what domino effects this has had on the vulnerable that, rely on this help. Do you think that by any chance the insurgent group may have weaponized this withdrawal of aid, to change the narrative and turn the people against government?
Well, for us in Yobe State, that's why we didn't take it lightly, because when we sleep peacefully in our homes, we know because the security has improved. And we have the experience of the past, and we don't want to go back there. There are times in the past, 7, 8 years ago, when young girls were easily indoctrinated into Boko Haram because of as simple as the money to buy sanitary pads. That has happened in the past, 7, 8, 9 years ago. And we don't want to go back to that era. And that's why the assessment of the gap was very fast and prioritizing the needs of women and young girls. We have safe spaces that are being managed by these funds that is no longer being managed. And we quickly make sure that relevant agencies have taken over management of those safe spaces. I just said 65,000 households that are receiving food from WFP will no longer get that food from February. So the governor immediately directed that these numbers should not be left. There should be an exit plan for them, and we provide those commodities to them in phases. And we have reached out to our partners at the national level and within the resources at the state level to procure those items to start closing the gaps. The implication is once you are dependent on something and it is being terminated and there's no plan for that, the negative coping mechanism has consequences. And of course, it will affect security issues and other negative vices. But then, as a responsible government, the data can speak, and once you have the data, you have no reason to not act.
If I got you right, you said about $560 million.
For this year, it's needed based on the humanitarian need response plan that was developed in January at UN House for the Northeast states, for the base state, particularly Borno, Adamawa, and Yobe.
Okay, and this is huge. Now, what is a Yobe state or the other Northeast states? Are there things you're doing differently to kind of shore up the revenue base? Because manna is not going to fall from heaven. Yeah. So what are those things that you want to do differently from what you've been doing because of this huge shortfall, so that the people in your state or in the region will still smile that yes, our government is there for us?
For instance, in Yobe, we developed the State Action Plan for Internal Displacement. In that State Action Plan, we budgeted like 5% of the budget should be key into solution-driven interventions for IDPs. Fortunately, based on our last assessment, over 24% of the resources has been channeled to that angle. But that is not enough. It's not enough because we are competing with limited resources. So what the government did was to expand its network and look for other resources. That's why he met with ambassadors of like 5 countries. Governor Buni met with them early after the stop-work order to see how we can reprogram their resources that is already coming into the state, and so that they can key into our priorities. In health sector, we have a big, like for instance, in Yobe State is leading the country in terms of leadership in primary health care. And when you lead, and there are gaps now, for you to sustain that standard, you must work harder. And this is what the government is now doing. Apart from ensuring that budgets are being programmed to close those gaps, alternative sources from World Bank funded projects, from other countries, Germany, Qatar, the EU, and other alternative sources are being reprogrammed and maximized to close the gaps. But at the long run, the key is to ensure that the exit strategy is planned well so that these topics at a time will not increase the negative coping mechanism.
Well, aside humanitarian response, especially in Yobe State, what other, because addressing the root causes of this, the root causes of this humanitarian need is another issue. What is your state doing in terms of preventive measures so that, reliance on humanitarian aid is significantly reduced in terms of security, in terms of, flooding and all of that?
What we are doing differently is to empower our people in terms of agriculture. That is the deliberate effort the governor has taken, and empowering agriculture in a model that the farmer does not feel that burden in the mechanized agri system, where tractors and other mechanized machines that were provided are being used in such a way that the common man can access them. You go and pay some small stipend of money in the bank. A tractor driver will call you, go to your farm, give you the services and return. This system is being piloted and it's working. But no matter how we do it at Yobe State level, if it does not translate in other states, the after effect will go. Because when there are displacement in other states, they will come to other states and the burden will increase. When we have resurgence of polio, we're not praying, the certification that we have enjoyed as a country, if it affects one state, it will affect the country at large. But I'm happy, recently in Calabar, the federal government has convened the Council of Humanitarian Affairs and Poverty Reduction, and it has developed a roadmap. And these are what will, in future, reduce the burden of the gap that is being created by AIDS withdrawal and other consequences. The reduction in food prices, the immediate measure that was taken by the government to reduce the food prices, the convening of common to know what can we do differently. UN organizations and all key stakeholders were there. But one key aspect that we have to look at as both as national and federal government is to bring public-private partnership. Private sector must come in. We have to bring our private sector to look at how they can invest in humanitarian response. Because, of course, private sector is profit-driven, and there are ways that you can invest, save lives, and also get the profit. So these are the areas that we are advocating for going into the future so that we will not be over-dependent on it.
All right, Dr. Goje Mohammed, it's a pleasure speaking with you for the past 30 minutes, and we definitely wish you well in your future endeavors. Thank you so much.
Thank you very much for having me.